Another common cause of knee pain is reduced space in the joint itself. You may find, if you've had an x-ray, that it says that the joint space is reduced. So these are a few exercises you can do to help bring some of that space back again. First one is to take a folded towel or blanket, and what you're going to do is put it right up into the space of the knee. So place your head onto the floor, wedge the blanket right up into the back of the knee. If you're not able to sit all the way back onto the heels, you may well not be able to, then take a bit of extra height under the buttocks. You could take a book or another folded blanket and sit for a moment just to allow that to settle. You may find it takes a few days before it gets more comfortable, in which case then you can start to reduce the height under the buttocks. So in this position, just sitting and allowing that joint space to open a little, you could do a few lengthening postures in this position so that the ribs are not poking out, but rather bring the ribs back, tailbone down, lengthening the arms. Then once that starts to become easier, you can give yourself a little more of a challenge, and this begins to really work with opening up the joint space, is using a dowel rod. So you take the dowel rod, same place, right up into the back of the knee, sit back, and you'll probably find, as before, that you won't be able to sit all the way back toward the heels. So take some extra height under the buttocks and wait for that to settle. Then working your way down the calf muscle, move the dowel rod maybe just 1 centimeter down toward the heel and sit back again. Hold it for a few moments, 20 or 30 seconds, and again 1 centimeter closer toward the heel. And you may find as you get further from the knee that you can reduce the height under the buttocks. 1 centimeter further down again, and one more time again. Try that one more time. So dowel rod right up into the back of the knee, sit back toward the heel, so you can rest your hands in front of you or behind you, because this can be quite uncomfortable at first. Squeeze the back of the knee, trying to squeeze the dowel rod with the muscles behind the knee, then release. Again, squeeze the back of the knee, squeeze the dowel rod, release. One more time, squeeze the back of the knee, and you'll find this helps to move blood into that area so that then you can sit down a little more easily. Once you've got a little more comfortable there, again move the dowel rod 1 centimeter down, sit back, squeeze the back of the knee again, squeeze the buttocks, relax them, squeeze the back of the knee, squeeze the buttocks, relax. One more time, squeeze, relax, and move the dowel down one more time. And you'll find in time this gets easier and easier. So it's important to distinguish between the pain that the dowel rod is producing and your actual knee pain. If this is causing you knee pain, then obviously take more height or something's not quite right. You should know the difference. So that's it as far as opening up the joint space goes. Give it a try and you'll see that this can help bring some more of the natural space to the knee back. Thank you. Namaste.